Interview Partners presents the health system in Mexico. The health system in Mexico is divided into two sectors, public and private sector. Public sector is formed out of two big groups, and the first group is formed by the institutions that provide with health services to workers, retired people, and their families. 80% are treated at Instituto Mexicano del Seguro Social (IMSS). These people are workers from private companies. The 18% are treated at Instituto de Seguridad y Servicios Sociales de los Trabajadores del Estado (ISSSTE), and these are workers from the government. And 2% are employees from Pemex, Sedena, and Semar, which gets treated at the Hospitales de Petróleos Mexicanos, Pemex, and the Secretaría de la Defensa Nacional, Sedena. And the second one is the Seguro Popular, which is used by the self-employed population, workers of the informal sector, unemployed people, and people that are not part of the job market, as well as their families and anyone who is not a beneficiary of any other institution. When they are in need of healthcare, they go to the clinics and hospitals of the Seguro Popular, and also they can go to hospitals of the Mexican Health Secretary. One of the major problems patients in public institutions face is absence of medications. Sometimes, when they have to fill out their prescription, at least one of the drugs is out of stock, which means they have to buy it at a private pharmacy. In 2011, Mexico was the second most important pharmaceutical market in Latin America, with an approximate worth of 190,000 million. Private care is based mainly on clinics and small and medium hospital units that provide direct service for profit. Since the 1970s, private medicine has improved its ability to provide service to the public by improving its infrastructure and financing, even though this growth is directly related to the consumer's pocket. The public system has very specific guidelines and protocols to follow. Outpatient therapies are paid out of our pockets, and so as any brand or generic drug bought in regular pharmacies. Out of the total private expenditure in health, 92% comes out of the Mexicans' pockets. Only 8% of private healthcare expenditure is covered by prepaid plan. Now a little insight regarding physicians in Mexico that work in the private sector. They usually have a mixed practice. They spend 50% of their time in private and 50% of their time in public sector. They work long hours with high workload. They usually compete for patients and rent offices in private hospitals. They usually prefer some brand medications, although a generic option is prescribed for those with lower income. This option is becoming increasingly popular in Mexico. Doctors are aware of the economic situation in Mexico, so in the end, the final choice is left to the patients when buying the medication. Interview Partners are your local fieldwork experts worldwide. We have a central recruitment and interviewing hub in Mexico City, 2 interviewing rooms for focus groups and in-depth interviews, Focus Vision-enabled facilities, and mobile streaming equipment. Also, we have access to research facilities in all the Latin American region, with high-specialty senior moderators and experienced interviewers. One of our strengths is that we have a multilingual streamlined project management for the entire region with personalized client service. We are here to help you, so if you require any further information, please do not hesitate in contact us. Have a great day.